This patient is currently in the proliferative phase of healing, entering into the maturation phase. Some indications for the cryotherapy would be acute pain, swelling, and edema prevention. A contraindication would be possible poor circulation if they have a history of it, as well as any kind of peripheral vascular disease and possible areas of impaired sensation due to surgery.
All right, Jake, how are you feeling after the exercise?
Pretty good. It feels tired.
Okay, yeah, and that's expected. I do notice a little bit of swelling there, which is totally normal with exercise. One way that we can kind of deal with some of the swelling and the edema prevention, as well as just help with some of the pain after the exercise, is to apply some cold cryotherapy. So I've got you an ice pack here, and I've got this towel on it so it's not going to burn your skin, which is something that can happen, so it's not super likely, but I don't use a barrier so it's not directly on your skin. And so we'll have you go ahead and lay down there. You don't have any kind of peripheral artery disease, do you?
No.
And the wound from your surgery looks pretty healed. You don't have any kind of history of poor circulation either. So, okay, wonderful. So go ahead and lay on down. I'm gonna put this pillow right on your knee. Similarly, you can try to give a little bit of flexion to expose the most amount of the tendon as possible, so that the heat or the cold can penetrate into that spot.
Is there some indications to be aware of?
I'm gonna go ahead and lay this right here on you. It's gonna be cold at first.
That's nice.
Okay. And just like we did with the heat, I'm gonna set a timer here for about 10 minutes, and I'm gonna give you this buzzer as well, this bell. If it's getting too cold, if we start to kind of feel some burning or pain from the cold, you can let us know. So right now it's just feeling cold. Eventually it'll start to feel kind of a burn. Afterwards it'll kind of start to go numb, and then you'll start to kind of just not really feel anything. And again, so if you were starting to kind of feel some numbness, that's kind of the purpose of it, and that's kind of where we want to get to. So I'll go ahead and leave you here for 10 minutes. Go ahead and ring this bell if it's starting to get super. All right, Jake, how are you feeling? You starting to feel a little bit numb?
It is, yeah.
Wonderful. I'm going to take this off you and kind of assess where we're at. So definitely notice a lot of the swelling in your knee went down, and that's exactly the purpose, one of the purposes of the cryotherapy. And you're probably just going to start to feel a little bit stiff just from the cold, and I would expect is the pain level probably a little bit lower.
Yeah, I don't feel anything.
Okay, perfect. That's what we want. And I'm just going to touch you here. Can you feel that? Is that pretty numb?
Yeah, I feel that. It's less, but yeah.
Okay, wonderful. That means you kind of hit the numbing phase of that. So I'm going to take this pillow right off from underneath you, and I want you to go ahead and try to flex your knee there just as much as you can. Feeling a little bit looser?
It does, yeah.
Wonderful. And that's one of the effects of the heat, the exercise, and then the ice at the end. Any questions for what we did as far as some of the modalities, the cryotherapy here?
I don't think so.
All right, wonderful. Well, everything is looking great, and we'll see you next time you come in.
All right.